Since the time a woman is born, she plays so many roles: daughter, sister, friend, wife, mother, grandmother, and so on. She always puts the well-being and interest of her near and dear ones above herself and gives herself the least priority. Being a gynae oncologist, throughout my working years, I have encountered women belonging to all strata of society. But there is one thing which unites them all, and that is giving least attention to one's own health. Well, if I just focus on my area of expertise, I'll be discussing about the two most common cancers affecting women and how both of them are mainly detected in advanced stages, mainly due to lack of awareness. The first and foremost is cancer breast and the second is cancer cervix. Most women with breast cancer are well educated and belong to a good socioeconomic strata. In contrast, most women with cancer cervix belong to poor socioeconomic classes. But both can be prevented by screening and detected and cured in early stages. So, starting with breast cancer. In our country, roughly 1 in 28 women are likely to develop breast cancer during their lifetime, and the risk starts from early 30s and peaks at 50 to 60 years. A combination of our genetic makeup, lifestyle, and environmental factors play a major role. The major lifestyle risk factors that we can count of are being weight gain, lack of exercise, excessive alcohol intake, whereas pregnancy and breastfeeding can decrease the risk. So how do we reduce the risk? First and foremost will be changing the lifestyle factors. All women should be breast aware, which means knowing what is normal for your breast and that you are aware as soon as you see any change. All women should get into the habit of examining their breasts themselves periodically. Beyond this, there is a screening test. A screening test is something which detects cancer in very early stages and which is mammogram. It is similar to X-ray of breast and it should be done every 1 to 2 yearly after the age of 40 till 75 years of age. Now coming to cancer cervix, it roughly affects 1 in 50 women in their lifetime in our country. But the major risk factors being unsafe sexual practices like early age at sexual intercourse, multiple partners, poor genital hygiene, and infection by human papilloma virus. Smoking is also a contributor. So prevention is by vaccine against that virus, which sadly is currently not under our government immunization program, but it can be purchased at a cost of around 2,000 rupees. It is almost 99% effective to prevent cancer cervix, and it has to be given to girls between 9 to 15 years of age, but it can be given till 45 years. Screening of cancer is by testing the cells from the cervix, which is called pap smear, or testing the presence of HPV DNA in the cervix, which is the virus DNA. Both of these are simple tests and they are done by a gynae person and can be started at 30 years and repeated every 3 to 5 years depending on the test which we are using, and it can be done till 65 years of age. So you see both of these cancers have a common thing, and we can see that a little effort is needed on the part of our women, which can go a long way in saving the lives. All we need is a will to take care of ourselves. You have to get yourself examined and screened and get your girls vaccinated. After all, it's you, a woman, who makes a house and home. So the health of the women of the household should be the highest priority in any family. Thank you.